And then the rationale behind going on strike are a lot of demands that we've requested from federal government in which they're yet to meet those demands. And we gave 2 weeks ultimatum with the hope that this will make federal government see reasons why we need to come to the drawing table, dialogue, and agree on what we feel will actually be beneficial to both parties. Which, as of the time we embarked on the strike, which was yesterday, federal government has not called on us for any negotiation, and the demands are numerous, which I'll just highlight one or two of them. One of the demands is the issue of shortage of manpower, which is actually across the nation, not just in a particular center. It's affecting all federal and even some state tertiary institutions. And the issue with the shortage of manpower is that there's a lot of bureaucracy bottleneck in getting waivers and approval to recruit, and it takes close to 6 to 8, almost some centers a year before their management are able to actually get approval for recruitment. And another issue that we put in our communique is the bill that was sponsored by Honorable Johnson on not issuing a license to newly graduated medical doctors until after 5 years. We feel this shouldn't be this should not be kind of bills to be passed, because it will add more to the brain drain issue, and it will also affect the health sector in general. So these are the things we want the federal government to look at and then discard or put a stop to the bill being sponsored by the Honorable. Another issue we've been discussing is that we realized that ever since they did the Abuja Declaration in 2001, they are yet to implement the agreement, which is the 50% to be allocated to health. And then we feel doing this it will go a long way to improve the health sector. And then we feel federal government should look into this and do the needful in terms of increasing or allocating more percentage, if possible 15% of the total budget, 15% to health to be precise. And also concerning the issue of the recruitment, even in some cases when they recruit, it takes a lot of time to even get approval for such resident to be captured and start getting salary, because you have some cases whereby you start working at a particular month, maybe December, you now have to wait till after 5 6 months before payment will start, and IPs will not come and capture until the fourth of the fifth month after going back and forth. And this is actually making people not to want to come and not to come for specialist training, and it's affecting the training, and it's also making the brain drain more prominent and more apparent to the populace. So another thing which we want the federal government to do is the infrastructure, because aside the fact that there are not enough human resources to do the work, what we use in our practice is most of them are obsolete compared to what our colleagues who have left the system or who have left Nigeria are making use of in their own in the Western region. There was a time I was in a clinic and the professor was telling me that this same equipment you are seeing was what his own oga or his own teacher then used in taking in tutoring him during his own time, and we are still using the same thing. So, and when we have a lot of technology, a lot of new things that have come into the system, which we feel federal government should do the needful in addressing this. So some of our demands also we look at the state tertiary institution and also private sector institution who have some peculiarity in their own issue. And one of them is domestication of the Medical Resident Training Act, which so many of the state government are yet to domesticate in their center. These are the things we want federal government to look at, and then hopefully they'll call us for a deliberation, and then we'll chat away forward from there. The no work no pay, which was implemented or used for the university staff that went on strike, We never can say. If you don't want to use it, no problem. But the fact is this: our demands are not for selfish reasons. Our demands is for, if you look at our demands, majority of what is there is for the patient. I can't imagine coming to a teaching hospital by 8 a.m. and I won't see a doctor until 12 p.m. or 1 p.m. Not because there's no doctor around, but we really have one or two, seeing close to 200 patients. So the waiting time is there, and that's why we are saying implement the 15%, recruit more doctors or health workers, and even adjust or address the bottleneck in getting waivers for the recruitment. And so our demands are for the nation, for the masses, and we are sure, that since we are fighting for the right cause, we are willing to take the risks, and we know what will likely happen if we go this way, and we are ready to actually go the right way to get the right things to be done. Concerning the medical tourism, it definitely has its advantages and it has its advantage. But for the leaders who travel there for their medical reasons, that's a personal, in my opinion, it's their personal stuff. Because in recent time we saw the vice president had a surgery in one of the hospitals in Nigeria. He stayed back to have a surgery and it was successful. So it's more of a personal choice. But the most important thing that I feel we need to do is we have a lot of policy that can improve and make things work in the health sector. Implementation is what we have as issues. So I feel the current government, they have 2 weeks to go, and within that 2 weeks, a lot of things can still be achieved. I think they need to look inward and do the needful in implementing the policies that are already on ground, that will improve the health sector and also improve the health status of the populace, and as well as this also this is a form of a message too for the incoming government to know that there is a lot of work to be done in the health sector. And like I've said, if you look at the Abuja Declaration 2001, if that 15% is implemented, it will go a long way to actually address all these issues. Because it was a conference by the African Union in 2001 whereby they agreed that for them to be able to get things done and improve their status of their people, they need to actually allocate 15% to health. So doing this, it will go a long way to assist a lot of things. Service delivery will be improved. In terms of recruitment and all that, every other thing attached to it, a lot of things will actually go in terms of improvement. There will be enough funds to acquire new technology, vaccines, and products in terms of drugs and medications that will be used by the system. So these are the things we feel they should do. Like we one of our demands is to reduce or even prevent the bottleneck in getting waivers for recruitment, because people are overworked. You see two nurses manning a ward of like 50 patients in a clinic. Like I said, waiting time in the clinic now is even worse for any patient coming in. Like, okay, I have an appointment with a doctor, I'm a civil servant, and my boss at work give 2 hours for me to go and see my doctor. And I get to the hospital, I've spent 5 hours before even seeing a doctor. Not just when I seen a doctor, it's in phases. You need to go and get your folder at the record. The nurses will take vital signs. They'll kill you. Once it's your turn, you see the doctor. When medication is written, you go and pay at the revenue or cashier side. Then you go to the pharmacy, go and pay, then come back to the pharmacy. And at each of these stages, you will meet queues. So this is why we said recruiting health workers, more health workers into the system, and also the bottleneck involved in the recruitment process need to be shortened, or I don't know how they would do it. Make sure that the bottleneck within 3-4 months, give them approval and let them start recruitment. Unlike what we have currently, whereby you take up to 8 months before you get waivers. Some institution recruited recently, and the recruitment they did was for waiver for last year, and this 2023. And for the waiver for 2023, they don't have it yet, and this is me already. So you get what I'm saying? So I feel that statistics, I'm not in Kano, so I don't know if, but I'm so sure no doctor falsify statistics. But it's also happening in our own area too, whereby you see a doctor seeing close to 100 patients at a particular clinic day, which is even way above the recommended number by WHO. So these are the things we feel government can look into, and it's part of our demands. We have like 8 to 9 demands, and one of them is this particular recruitment process and bottleneck. So we feel they should do the needful in this. And there was a time around April whereby Ministry of Health also agreed with us that they need to do something, and there was a recommendation given to them. Till now, there's no circular or to that effect, so that they can be easy recruitment in terms of when some people leave, you can easily replace them with another set of health workers who are ready and are fit to actually occupy those positions that have left that have been left by some professional, either that done with their program or they've left for the Western world.